Please can you present this case to me?
This gentleman has chronic liver disease. He has no clinical signs of portal hypertension, and although he's deeply jaundiced, he has no other clinical signs of decompensation, for example ascites or encephalopathy. The clinical signs of his chronic liver disease are hepatomegaly, with a palpable liver edge 3 centimetres below the costal margin. He has multiple spider nevi. He has bruising. He also has evidence of recent weight loss. As well as this, he has tattoos on his arms and has corneal arcus. This may be related or may just be age related.
What are the causes of chronic liver disease?
In the UK, the commonest causes of chronic liver disease are alcoholic liver disease and non-alcoholic fatty liver disease. Globally, probably the commonest causes are viral hepatitis. Other important differential diagnoses include autoimmune disorders such as autoimmune hepatitis, PBC or PSC, hemochromatosis or Wilson's disease, alpha-1 antitrypsin deficiency, HHT, or liver disease may also be associated with various drugs.
What investigations would you do on this gentleman if this was the first consultation you've had with him?
I'd like to start by taking a full history, including a history of all other comorbidities, a drug history, an alcohol history, and a travel and family history. In terms of investigations, I'd like to perform blood tests, I'd like to perform a full blood count, Usinese, LFTs and a coagulation screen. I'd also like to undertake bloodborne virus screening. I'd like to check his ferritin and ceruloplasmin, and I'd like to do an autoantibody screen. Having done this, I would consider progressing to imaging with an ultrasound, possibly a CT, and possibly arrange a biopsy.
You mentioned autoantibodies there. Which specific autoantibodies would you request?
The autoantibodies of interest would be ANA, AMA, smooth muscle antibody, and LKM antibody. Also, it would be worth considering sending tumour markers, which in the case of HCC would be AFP.
So if I was to tell you this gentleman had a positive anti-mitochondrial antibody and an elevated IgM level, what diagnosis would that lead you to suspect?
Based on the clinical findings, if I were presented with those investigations, I would think that the most likely diagnosis is PBC, or primary biliary cholangitis, previously termed primary biliary cirrhosis.
How do patients with PBC usually present?
As in this gentleman's case, they can present with evidence of chronic liver disease. However, actually the commonest symptoms, and certainly the first symptoms, tend to be a generalised fatigue and often quite severe pruritus.
And what are the complications of PBC?
As this gentleman shows, it can progress to chronic liver disease and cirrhosis. There's also a link with malignancy. And
what type of malignancy?
The most common malignancy is hepatocellular carcinoma.
How might you treat someone with PBC?
The treatment of choice is ursodeoxycholic acid, which can relieve symptoms and also improve prognosis.
And if the patient's condition progresses despite ursodeoxycholic acid?
Ultimately, the only other treatment available would be listing him for transplantation.
Okay, thank you very much.